Myself, Dr. Tanima Singhal, and I welcome you all on today's session. So, put your questions in the chat box, and I'll answer them. Till then, I'll start the questions which you all have filled in the Google form. First, I'll answer that, and then I'll take the live questions. So you can put your questions in the chat box. Let me first start the questions from the Google form. So, first question is from Shara Fahim. Just give me 1 minute. Let me open the chats also in a better way so that I can see them properly. First question is from Shara Fahim, which is, hello, I am a first-time mom. I am exclusively breastfeeding my 2.5-year-old baby girl. The problem is that she is drinking only from my left breast and totally refusing the right side. When I examine my right nipple, it seems flat and not erected as left nipple. But when I hand express, milk flows from it. Sometimes my right underarm was painful as a result of milk engorgement. I'm really worried because my family members gave her additional formula to compensate her hunger. What I have to do? I have to pump from the right side. Some people suggest me to pump from the other breast and feed her. Kindly help me. Okay, so first of all, Shara, what you need to do since you have been an exclusively breastfeeding mother, first of all, congratulations for that. And now you are saying that the baby is feeding only from the left breast and totally refusing the right side because the baby is habitual to the left side and more comfortable that side. So what you need to do every time you start the breastfeeding, first put her on the right breast, let her feed for 1 minute or few seconds also if she's staying, I'm fine. Then you shift her to the left breast, let her feed, and afterwards just put her for some more time on the right breast. If she doesn't come still, then you pump on that side. That's all. You just need to keep creating demand on the right side so that the milk supply starts coming in. And because you will be trying to put the baby on the right side also, you need to just give trials every time before feeding from the left breast and after feeding from the left breast. So, and thereafter pumping. So first thing, when the baby will be put on the right breast again and again, the side will also become, the flow will improve. The breast will become softer so that the baby can latch properly. And once you are pumping later on, it will help to create more demand and the supply will also come in. So you need to follow this, Shara. Next question is from Apsara. No, it is Apsana. Okay. My son is 4 months old and has completely stopped breastfeeding, and also the milk supply was never so good. He was introduced bottle feed very earlier. Okay, so first of all, don't worry. For a 4-month-old baby, we can increase the breast milk like back. So what you need to do, you need to follow the process of improving the milk supply. What are those? Number one, you need to increase the demand. So right now, if your baby is not coming on the breast, you need to start pumping. Second thing, you need to improve your water intake. Third, you need to do oil massage and the warm compress. Fourth, you need to take some Galactogox. What I recommend is Lactomagic powder and Morico tablets. Next is you need to keep the baby skin to skin. And the last, you need to keep a track of baby's weight gain. So follow all these things. It will help you to increase your milk supply. Follow for 1 week. If you don't get better results, please contact us. We will have a consultation with our team of doctors. They will give you a proper customized protocol because the baby is already 4 months old. We can't just wait on free tips and tricks. We need to follow a customized plan as per your recommend or your condition. So just see if you can improve the milk in 1 week. If it is not improving, then contact us and talk to our experts. Next question is from Dr. Mamta. Can we start pumping milk before delivery? What is the best food to start for good milk production during 35 weeks? So I would not advise you to pump before delivery. You just need to keep patience with that. But once your baby is born, then you should put the baby on the breast within half an hour of your delivery. And then what is the best food? So you need to take a good healthy diet, improve your protein intake. And if you need to start with some Galactogox, then I recommend Lactomagic powder and Morico tablets. Next is Sudha Reddy, low milk supply. So I have just given the tips for improving the milk supply. You can follow that. Parmeshwari. Now I have enough milk. When my baby grows, I need more milk. My breast looks tight, light, never feel heavy breast, but I am feeding. I want it to improve my milk production. So first of all, to know whether your milk supply is enough or not, you need to keep a check of your baby's weight. So till 3 months, we need around 150 to 200 grams per week. From 3 months to 4.5 months, we need 100 to 150 grams per week. From 4.5 to 6 months, we need 100 grams per week. So if your baby is gaining weight properly, Parmeshwari, you don't need to worry about your milk supply going low later on. But right now, if you're looking to improve your milk production, I have just given the tips. You can follow that. Next question is from Supriya Teke. I am 31 years old. I delivered a baby boy 2 weeks ago and with a birth weight of 2.6 kgs with a C-section. Initially, my breast, just a minute, section. Initially, my breast became tight. After 1 week, my breast was soft. Is soft breast and milk is not leaking when baby is crying means low milk supply? No, it is not like that, Supriya. So, tightness of breast or leaking of breast doesn't mean that you have overflow or oversupply of milk. It is basically just showing a positive hormonal reflex. So, soft breast doesn't mean, or the milk is not leaking, that doesn't mean that you don't have enough milk. So first you need to be confident about your milk supply. It is not like that if the breast is not leaking, your milk supply is not enough. Just give me 1 minute, girls. So let me go to the next question. Next question, Divya, latching difficulty. So for latching difficulties, first let me know what difficulty you are facing so that I can answer it. Sakina, low milk supply, already answered in this question. You can watch the recording and if you are live present, you would have heard the answer. Deepika, low milk supply, already answered. Monica Gupta, low milk supply, already answered. Amritpal, no milk supply. So if no milk supply, then you need to work on the relactation process. I have just answered about it. Diksha, low milk supply, already answered. Gayatri, how to stop combined formula intake with breastfeeding? If we pump milk during breastfeeding, how it needs to be done? You need to put the baby on the breast every time and later on you need to pump. This will improve the demand on your body and it will make more supply for you. Richa, no milk supply. So for all the mothers who are saying no milk supply, it is basically a relactation case. For no milk supply, I would ask you to contact the team and get your consultation done because no milk supply, if you start working by yourself, it will take a lot of time and efforts into this. So better all those who are facing no milk supply, like your milk supply is extremely in drops or zero, then don't wait for yourself that the milk will come by yourself. You need to have a customized plan for you. But those who are facing low milk supply can go with the tips which I am telling, but follow for 1 week and see. If it helps, if it is very good. If it is not, then just get a customized treatment plan for you. Tanuja wants to relactate. So I've given the general guidelines for improving the milk supply, but if you're looking for a relactation, then you can go for a customized plan that will help you to get your milk supply faster. But otherwise, general routine, general guidelines to increase the milk supply, I've already answered. Neha, low milk supply, latching issue. Sudha, low milk supply. Himanshi, latching and baby not sucking. She starts crying. Suhani, low milk supply. Srividya, low milk supply. Lakshmi, low milk. All those who have written low milk supply, I have already answered. So just you can follow those tips. So I'm not taking the ones which have written about the low milk supply. Next is Stuti. Baby cries loudly when latching and does not latch. Baby is on katori feeding. So Stuti, what you can do if your baby is not latching, then every time you just try and if she is not latching, then you pump. This will create an extra demand for your body to make milk supply. Okay, next are all low milk supply. I'm not answering those because I've already answered. Let me see the questions which are in the chat box. Nikhila, low milk supply. I hope you've got the answer, Nikhila, of low milk supply. If there is something more, if you want to ask, just put it in the chat box. Namrata, ma'am, I am taking medication from you since December 1. I have a little increased supply for 2 days of around 25 ml from 7 to 8 ml in single expression, but it declined again today. Also, when can I expect supply up to baby requirement of 90 ml as of now? So, Namrata, first let me know that how many days have you followed the treatment plan? And like, have you taken the assessment call from our doctors? Because I think, Namrata, you are not directly connected to me. You are connected with any of my trained doctors. Just let me know how many days you have followed the treatment plan so that I can guide you on this. SP 8 months बेबी के साथ मिल्क सप्लाई कैसे बढ़ाएं मैम? देखिए 8 मंथ्स बेबी के साथ बेबी आपका ऑलरेडी सॉलिड्स भी ले रहा होगा और अगर वो फॉर्मूला भी ले रहा है तो आपको करना ये है कि हर बार बच्चे को जब आप फॉर्मूला देते हो, अगर आपका बच्चा ऑलरेडी ब्रेस्ट फीडिंग कर रहा है तो आप उसको हर बार पहले ब्रेस्ट फीडिंग कराओ और बच्चे को जब भी आपको बॉटल देने पड़ता है तो फिर आप पंप करना शुरू करो। अगर आपका बच्चा बिल्कुल भी ब्रेस्ट पे नहीं आता है तो आपको एनी हाउ पंपिंग करके मिल्क की डिमांड क्रिएट करनी होगी। साथ में जो मैंने अभी मेथड्स बताए हैं मिल्क सप्लाई के लिए कि वाटर इनटेक और बाकी सब कुछ, वो सब चीजें आपको स्टार्ट करनी होंगी। Neha. Ma'am, my baby is 8 months old. He is not latching. He is totally dependent on formula milk, low milk supply issue. So Neha, I have just answered about the low milk supply issues, what all things you need to do. If you have any specific more queries into this, just let me know in the chat box. Mridmay. Hi ma'am, today joined late. Where can I put the question? In the same, where you have put this thing, I have joined late. Just put your question here in the chat box. Lakshmi. Ma'am, I am using Morico tablets and Lactomagic powder, but still milk supply is low. I am getting 3 to 5 ml while pumping. So Lakshmi, since how many days have you started the treatment protocols and are you following the other methods? And just let me know about it. How many days have you followed the treatment protocols? Neha, I'm 36 years old and he is my third child. Okay, so please put your question all in one because if you put like one by one, the other mother's question will come in between and it disturbs the flow. So put your questions properly in a one full way so that I know what is your question. Ruchika, I'm not getting domperidone. Can I take any other medication of the same composition in its place? If yes, then which one? So there are many brands of domperidone like Dom DT, Vomistop, what all things are all these things are there. So if just try getting any other brand if possible. And still, if you're not getting it, just inform the helpline team. They will give you some other alternatives for it. Neha, baby not sucking the. Neha, please take all full of your question and put it one place and then post it in this. Srishti, my baby is on combination feed. Milk supply is less. He feeds from left breast for some time but doesn't latch from the right side. So Srishti, what you do, you first feed the baby on one side, like as you said, left side. Then you start, just try to put the baby on the right side. And if the baby is not latching, then you start pumping. But you need to try to the baby to feed from the right side every feeding session. And once the baby is not latching on the right side, then only you need to start the pumping. So you need to first try to put the baby on the right breast. If the baby is not coming, then you pump. But you need to do this for every feeding session. Lakshmi, ma'am, is that massaging oil to for milk flow or milk production? That is for milk flow. You need to do oil massage on the breast. That will improve the flow of the milk. Stuti, can my baby suck directly from the breast since birth? He is on Katori feeding 16 days old. So basically, Stuti, what happens if we are feeding the baby through Katori feeding, the babies forget the method of how to suckle because Katori feeding is a very different method where you just put the milk in the baby's mouth and the baby just gulps the milk. The baby doesn't suckle the milk. It is basically the baby is only gulping the milk. So if you want to train your baby for having a good sucking, then you can just put your small finger, first clean your hands properly. This is called as finger exercises. You need to keep your finger in the baby's mouth. So once the baby starts suckling, then just put the baby on the breast. This you need to follow for every feeding sessions. Next is Sri Vidya, how to increase the milk supply. Already I have answered about this, but otherwise you can still put your question if you are feeling that the answer was not appropriate. Like I've already answered, maybe Sri Vidya, you have joined late. So let me repeat it, the answer for this, how to improve the milk supply. So for improving the milk supply, first of all, you need to create proper demand on your body. So if your baby is already breastfeeding, but you need to give formula milk to your child, then after every feeding session, just pump for 5 to 10 minutes. If your baby is not at all coming on the breast and the baby is on exclusive bottle feeding, then you need to create the demand by following the pumping sessions. Like you need to pump regularly. Other than this, you need to improve your water intake. Second, you need to do oil massage and the warm compress. Third, you need to take galactogogues. The galactogogues which I suggest are Lactomagic powder and Morico tablets. Next is you need to keep the baby skin to skin with you, and also you need to keep the keep check of the baby's weight gain. Next question is from Sudha. Which brand has good galactogog powder? What I recommend is Lactomagic powder and Morico tablets. Namrata, ma'am, I have followed protocol for around 3 weeks and connected to Dr. Binny. Though I'm not able to pump 7 to 8 times every day, but 5 times at least every day. So, Namrata, if you're, how many times the baby is taking feeds? Just let me know. See, we need to create the demand as per the baby's requirement. So suppose your baby is taking feeds around 8 to 10 times or 6 to 8 times. Then we need to create the demand that many times so that your body understands the demand and starts making milk accordingly. So just let me know, Namrata, how many times your baby is taking feeds and how many times you're pumping. Sri Vidya. I'm 37 years old. My baby is 4 months old. I have low milk supply even after using homeopathic medicine. Can you tell me the foods that increase the milk supply? So for foods, what I can suggest is improve protein intake in your body. So for protein, if you're a vegetarian, then have sprouts. You can have a soya bean and all the dairy products. If you're a non-vegetarian who eats only eggs, then start taking 2 eggs per day. And if you're a non-vegetarian who like along with the eggs, then take 2 eggs and start taking thrice to 4 times of non-veg during in a week. So that will help to improve the protein intake in your body. So protein is important for milk production and also to manage all the postpartum recovery. And regarding if you're facing low milk supply and your baby is already 4 months old, so Sri Vidya, I will not suggest you to keep moving by yourself now because 4 months have already gone with low milk supply. So right now, if you're not able to improve it further, you need a customized, you need a proper help into this, then just contact the helpline team or the inquiry team and get your consultation like appointment as soon as possible so that you start improving the milk supply. Next question is from Rinmay Deka. Baby not opening mouth wide to latch properly, so I am having nipple soreness. Started the medicine you have suggested uh, from 19, but due to fussiness of my baby, I am facing issues with the pumping and breast massage. Milk supply is almost same, but sometimes little bit more. How can I teach my baby to latch properly? So for if the baby is not opening a wide mouth, then listen to me how you can make the baby open a wide mouth. So hold the breast in U shape from below and hold the baby from the other hand. And when you are bringing the baby towards your breast, make sure the baby's head is extended. So baby's head should be like this. So by movement of this wrist, like just moving your hand back, the baby's head will be little back so that the baby's chin will be touching the mother's breast. Now with the hand where you are holding the breast, just tickle the baby, your nipple in the baby's upper lip. When you tickle your nipple on the baby's upper lip, the baby will open the mouth. So if the baby is not opening a wide mouth, just like bring the baby towards breast and like tease the baby. You're trying to bring the baby on the breast, but not giving the milk. So the baby will open a big mouth and will do like this. Then that time you can take the baby inside. So basically, this is the method of opening the baby's mouth wide open. So this you have to practice regularly with your baby, and slowly the baby will start opening a wide mouth with this midnight. So, and also once your baby latches properly, don't remove the hand which is holding the breast. Because if you remove the hand because of the weight of the breast, the baby will again come on the nipple. So that's why you need to keep holding the breast while during the feeding session. To support your hand, you keep a small stool nearby and keep your hand on that so that it helps to latch the baby in a proper way throughout the feeding session. Okay. Mrinmay, was that helpful? I hope the answers are getting helpful for you. If you still feel that some more things to be added, just you can put them in the chat box. Sri Vidya, can you text the name of medicine to increase the milk supply? Just a minute. Lacto Magic powder and Modico tablets. It's there in the chat box. Okay, so next question is from Sri Vidya. I've already answered. Namrata, baby takes feed 6 to 7 times a day. I pump around 5 times a day. Yeah, so Namrata, see, the baby's demand is more than what we are creating the demand on our body. So suppose if now I can give you a easy tip here. So suppose you're not able to find time to pump every time. Either you can go for a variable breast pump because variable breast pump can be can be taken like can be worn inside your clothes so that you can keep doing your course with the pumping. Second thing is like try to pump as per the baby's demand, but suppose you're not able to do, at least do hand expression. You need to create the demand every time. So if our demand on our body is less than the baby's demand, the milk supply will not increase as much as it should increase. So Namrata, that's why you need to follow the pumping routine right now and try to feed the baby every time, like put the baby. So what you can do, you put the baby on one breast, try for 5-10 minutes, not coming baby, give half of the amount and then take the baby on the other breast. Then try for some time. If not at all coming, then pump. But keep repeating this every session. So we need to increase the demand as per the baby's requirements so that the milk supply comes in, Namrata. Okay. Next is Srishti. During pumping session, sometimes I don't get any milk, but I get some milk with hand expression. Should I pump even if I am not getting any milk in the pump? Yes. So what happens? Pumping, actually first pump and then hand expression is always helpful because pump usually takes out the milk in one direction mostly. But when we do hand expressions, we obviously because it is our hand, it is our manual effort. We keep moving the hands here and there. So the breast has different quadrants. So milk starts coming from each of the quadrant. So we get better milk when we are hand expressing. You might be, I think, Srishti, you are working on a relactation because what you are selling right now, it looks like a relactation journey. So if you are not getting milk with the pump, but with the hand expression, it looks like you are on a relactation journey. So for relactation, this is a very common finding in first 1 or 2 weeks. Slowly, you will start getting milk with the pump also, but just keep doing, Srishti. If you are getting milk, sometimes not, but hand expression you are getting, that means you're moving in the correct direction. Just keep moving in this. Next is Saranya. My baby is 6 months old. When she came near to breast, she is looking here and there and not able to latch. So this shows that she is distracted. So what you do, just dim the lights of the room and try to feed the baby in little dark so that she doesn't see here and there and she's not distracted. Second thing, see if there are some toys around which is distracting her. Third, just don't try to talk to the baby. Many times the babies are talking and we also respond because they look very cute. So don't do that because just make sure that that should be a quiet, peaceful time for them to latch. 6 months baby obviously is a lot of distracted. There is a lot of distraction into this. If your baby is feeding properly in the night or in the day when she's sleeping, that means milk supply is not an issue. It is basically there's a distraction which you need to work upon, Saranya. Next question is from iPhone. I have two questions. First, my son is 2.5 months old. He's exclusively breastfed. His birth weight was 3.59. At 2 months, it is 4.5. Is it sufficient? So just give me 1 minute. Let me just calculate. 2.5 months is 10 weeks. So I need 200 grams from birth weight, 2 kgs. So 3.59. I need 3.59 add 2. So I need 5.59. Your baby's weight is right now 4.5 kg. So this is little less. Obviously, this is nearly 1 kg less. So maybe there was initial lag. Initially, the baby didn't increase the weight as much. And if it is an exclusive breastfeeding baby, we need to work on the weight gain because it is not increasing as what is desired to be increased. Second is my milk supply decreases on some days. What is the reason of this inconsistent milk supply? How can I improve my milk supply? So right now it is showing because the weight gain is not as per the requirements. It means your milk supply is not improving as per the baby's requirement is improving. So Namrata, you need to work on your milk supply. I have already answered this question on how to increase the milk supply. Just follow that. Uh, right now your baby is 2.5 months old. A growth spurt is coming at 3 months. We need to improve the milk supply faster because at 3 months, the baby is already going into a growth spurt where the baby will require the milk more. And right now itself, we are seeing that you are going through a low phase of milk supply. So then if the weight is too less and the weight is not increasing, your pediatrician will put you on formula, which we don't want. So just start working on your milk supply. Just see if you can take the consultation. So that will help the process to be faster. Otherwise, just follow the things which I have just told you right now. Next question is from Varsha. Hello मैम, मैंने आपके यहाँ तो ज्वाइन न्यू मैम ने जो क्या हेलो मैम, आपके यहाँ जो भी न्यू मॉम ने ज्वाइनिंग किया उसको उसमें से किसी को मिल्क सप्लाई नहीं हुआ हो, ऐसा हुआ है या नहीं? मैम मेरा 12 दिन हुआ है बट अभी मिल्क सप्लाई इम्प्रूव नहीं हो रहा है, इंक्रीज नहीं हो रहा है। तो वर्षा पहले आप मुझे एक्चुअली देखिए, हमारे पास अगर कोई भी मदर्स हैं, अगर मिल्क सप्लाई की अगर हम बात करें तो जो आप लोगों को प्रोटोकॉल्स दिए जाते हैं अगर आप उसको 100% फॉलो करोगे तो ऐसा कोई मदर नहीं होता जिसको मिल्क सप्लाई इंप्रूव नहीं होता। अब आप कभी अगर कहो कि मुझे टाइम नहीं मिल पा रहा है, मैं पंप नहीं कर पा रही हूँ, या मैं मसा सिकाई नहीं कर पा रही हूँ, मुझे पानी पीने को नहीं हो पा रहा है, या मेडिसिन में भूल जाती हूँ, मैं वेट लेना भूल गई, तो अगर आप प्रोटोकॉल्स में कुछ चीजें मिस करोगे तो आपको टाइम ज्यादा लगेगा। मिल्क सप्लाई तो तब भी इंप्रूव होगा लेकिन आपको टाइम ज्यादा लगेगा। तो वर्षा आप मुझे पहले ये बताइए कि आप सारे प्रोटोकॉल्स प्रॉपरली पूरे फॉलो कर रहे हो जो आपको मिले हैं, या उसमें कुछ ऊपर नीचे हो रहा है? Srividya, how to use this powder and tablets? So powder has to be taken with milk or water, preferably with milk. If you have any issues with the milk, then you can go with the powder with that water. And tablets have to be taken with the water. Now dosage, because see, this is a generalized thing. I don't know what is your milk requirement, how much you're looking for. So the correct dosages, I will not be able to advise you now without knowing what is your history. But otherwise, on a safer side, you can start taking twice a day with that वर्षा। और नॉर्मली कितने दिन बाद मिल्क सप्लाई इंक्रीज होना स्टार्ट होता है? तो पहले वर्षा मुझे आप अपनी पूरी हिस्ट्री बताइए कि आपका बेबी कितना बड़ा है, आपका मिल्क सप्लाई कितना है, अभी फॉर्मूला आप कितना दे रहे हो? अभी बहुत सारे क्वेश्चंस है इसमें वर्षा। मैं ऐसे मतलब ऐसे जनरली मैं कैसे बता दूं कि आपका मिल्क सप्लाई कितना इंक्रीज होना चाहिए? मैं एक ही चीज आपको बता सकती हूँ कि अगर आप प्रोटोकॉल्स को प्रॉपरली फॉलो कर रहे हो तो मिल्क सप्लाई 100% बढ़ेगा। अगर आपका प्रोटोकॉल्स में कोई चीजें पूरी नहीं हो पा रही हैं तो जरूर मैं मान सकती हूँ कि मिल्क सप्लाई हो सकता है आपका उतना इंक्रीज ना हुआ हो जितना आप एक्सपेक्ट कर रहे थे। Richa, my nipples pop out only drops of milk only, which irritates my baby while she tries to feed. So in that way, what you do, just try to put the baby however it is comfortable. Don't try to push hard into this for a longer hours. Suppose you tried to put the baby on the breast for and the baby stayed for some seconds or for some minutes. Then as the baby starts getting irritated, give her the express breast milk or formula, whatever you're giving right now, and you start pumping on your breast. For every feeding session you need to do that. Other than following the also along with that, the following the other methods of increasing the milk supply, slowly you will see the milk supply will start increasing and the baby will feel less fussy on the breast while having the improving the overall output of milk. कोथिया प्रियंका, मैम मेरी बच्ची 2.5 महीने की है, वो अच्छे से फीड नहीं कर पा रही है क्योंकि फीडिंग भी नहीं आता और फीड करवाते समय बहुत पेन होता है क्योंकि वो आर्टिफिशियल निपल 6 से फीड करती है। ओके, सो देखो 2.5 महीने की बच्ची अगर फीडिंग नहीं कर पा रही है क्योंकि आपने ऑलरेडी बोला कि फीडिंग मिल्क अच्छे से नहीं आ रहा है, तो अगर मिल्क नहीं आ रहा है तो बच्चा कैसे फीडिंग करेगा? प्रियंका आप खुद ही सोचो ना। तो पहले तो, और आपने ये भी बताया कि आपको फीडिंग करते समय बहुत पेन हो रहा है। पेन होगा तो आप फीडिंग कब तक कराओगे, कितने दिन करा पाओगे? अगर पेन होगा तो ऑब्वियसली आपके लिए भी बहुत मुश्किल है ना उसको फीड करा पाना, और फिर जब मिल्क भी कम आ रहा है तो बच्चा भी ज्यादा मेहनत ज्यादा तेजी से खींचेगा तो उससे आपको और ज्यादा पेन होगा। तो प्रियंका सबसे पहले आप अपने मिल्क सप्लाई पे वर्क करिए, मिल्क फ्लो पे वर्क करिए, और बाकी लैचिंग टेक्निक को तो आपको सही करना ही होगा प्रियंका। आपको तीनों चीजों पे काम करना है तो फटाफट करिए क्योंकि 2.5 महीने की बच्ची हमारी ऑलरेडी हो गई है। अभी हम कितना और वेट करेंगे इसके लिए? तो आप पहले ट्राई करिए सारी चीजें। अगर आपसे लग रहा है आपको कि आपने ऑलरेडी बहुत एफर्ट्स ले लिए हैं, मिल्क सप्लाई इंप्रूव नहीं हो रही है, तो फिर ऑब्वियसली ना आपको टीम को ज्वाइन करना चाहिए और इस पे आगे वर्क करना चाहिए। बाकी मैंने जनरल गाइडलाइंस जो मिल्क सप्लाई को बढ़ाने के होने चाहिए वो मैंने अभी आप लोग को बताए हैं, आप उसको फॉलो कर सकते हो। Next question is from Neha. Ma'am, my baby's weight after birth is 2.3. He is now 8 months old. His weight is 8.2. It's good or not? So usually what I recommend, Neha, babies who are born between 3 to 3.5 should gain 8 kgs at 6 months. So if your baby is 2.5 months and the baby is right now 8.2 kgs, because the birth weight was less, that's why 8.2 is fine for it. But usually term babies, they weighing between 3 to 3.5 should have 8 kgs at 6 months. So we can say that the baby's birth weight was less. That's why the baby's weight right now at 8 months is less. But what I feel that we should work on the baby's weight. Like if the baby's birth weight was less, we can't sit back and say that okay, because the birth weight was less, that's why the weight gain is fine. We can work on to that by improving the hind milk and by giving more hind milk to the baby so that the weight gain improves with this. Sakina, why my baby feels itchy for sometimes after unlatching the baby every time? It happens because sometimes because of this hormonal reflex. If it is feeling very uncomfortable for you, then you can apply a little ice cube on that. That will help, Sakina. Divyashri, electric pumping is not helping to express breast milk. By hand expressing, not able to express more than 2 to 3 drops. I am using baby hug and rabbit breast pump. Both are not extracting. What? Both are not extracting the milk. Okay. So, Divya, how many times you are doing oil massage and warm compress? Because if your milk is not getting expressed by the pump and hand expression is also giving you 2 3 drops, then let me know how many times you're doing oil massage and warm compress, because this looks like a flow issue also. And are you taking all the medications as per the as per it is advised, and how many days you have followed the protocols? Second, can I feed from breast which has lumps, or should I first extract and throw the stock milk? Hey, no throwing. Any milk inside the breast is all sterile and good for the baby. It is not like that it is inside the body, and if it has a lump, then it is a spoiled milk. No, it is not. It is good milk. So what you do oil massage through warm compress, then hold the baby on the breast. If the baby is able to suckle, very good. Otherwise, just do pumping and then latch the baby, whatever works, maybe before the pump or after the pump, whatever, but feed the baby more from that side, so that you start, this lumps get dissolved and you start getting milk from that side. Richa, my baby is already on top feed as few drops irritates her as she tries to drink something. So that's what, Richa, if just try for 2-3 minutes and then you just pump. Just keep doing this for every feeding session. The milk supply, the demand will improve. That will help to improve the supply, and follow the other methods of increasing the milk supply, which I have just mentioned. Srividya, I just want to know whether usage of formula leads to any development delays in the child. So it's not about the development delays. It is all about the sugar intake, the preservative intake, the immunity of the child. So the formula milk is loaded with sugars. Just think about it. What is the source of formula milk? Is it made up of an organic source? So because what is the source of formula milk? What do you think? Is it made of cow milk? Is it made of buffalo milk? No, we don't have that much of cow milk or buffalo milk to available in the world to feed the adults and also to make the dabbas for the babies. It is all synthetic milk loaded with sugars and preservatives. Each box, now you can check the formula milk. All of you, just check the formula milk, whatever brand you are using, how much added milk they have, the added sugar they are putting. And we should not give sugar till 2 years of the baby. And right now with formula milk, we are already giving them so much of sugar. So that's why it is not safe for their health. And you know, diabetes capital. India is on a verge of becoming a diabetes capital. And with so much of sugars which we are giving to our babies every day, what do you think? They are not, that is not a healthy thing, healthy option. And when all of you mothers can produce breast milk, then work on it. Okay. So about the development delays, I can just say that it is a very harmful thing because it can lead to chronic issues. But development delays, that might not be here right now. Basically, immunity factor will be there. The baby might like fall ill regularly and will not be having good immunity. So and also because of such high content of sugar, because their kidneys, their liver are not developed properly to able to manage all that of sugar content which is going to them regularly. नेक्स्ट क्वेश्चन, वर्षा, यस मैंने प्रोटोकॉल पूरे नहीं होते थे, मेरा बेबी बीमार था इसलिए, बट अभी 3 दिन से सारे प्रोटोकॉल फॉलो कर रहे हूँ। तो वर्षा देखो, अभी मैंने आपको वही बोला ना, प्रोटोकॉल्स अगर आप प्रॉपर्ली फॉलो नहीं करोगे तो उतने रिजल्ट्स नहीं आएंगे। तो अभी आपने 3 दिन से फॉलो करना शुरू किया है, प्रॉपर्ली पूरा 7 डेज पहले फॉलो करिए, फिर टीम के पास वापस जाइए, वो आपको 100% आगे की चीजें बताएंगे। अभी 3 दिन हुए, थोड़ा पेशेंस रखिए, प्रॉपर्ली पूरे 7 डेज अपने प्रोटोकॉल्स को ठीक से फॉलो करिए। मेरा बेबी 3 मंथ 23 डेज का है, फॉर्मूला 24 घंटे में 7 से 8 बार 90 ml 1 टाइम देती हूँ, वेट 6.3 है। तो ठीक है वर्षा, अभी आपने 3 दिन से स्टार्ट किया है, तो अभी प्रॉपर्ली पूरा 7 डेज कंप्लीट करिए और फिर टीम को वापस बताइए। Srishti, which oil should be used for massage? Warm compress through warm water or electric bottle? So the oil which I recommend is Dr. Mix massage oil, which is available on Amazon, on Flipkart, and also on the Dr. Mix website. And for warm compress through warm water or electric bottle, so I would suggest first 5 days use a cotton cloth, warm it either on a iron press or roti tawa, and after 5 days you can shift to this heating pad or hot water bottle. Neha, which formula milk is good? I'm using for baby Similac. No formula milk is good. Don't ask me this question. Formula milk is out of the question. Okay? Whatever brand you are giving, just work on your breast milk supply and get rid of that formula. No brand is good. It is just playing with your emotions that which one is good. Okay? No formula milk is good. All of them are equally culprit. All of them have so much of sugars and preservatives. So no formula is good. I am okay if you are following it now, but work on your breast milk supply and get rid of the formula. Swati, Hi, ma'am. I have stopped the treatment suddenly. I want to start it again. I am taking whatever you have given medications previously up to 1 month, and after that, I will consult you. So don't follow for 1 month. Just follow for 1 week and get back to me. 1 month will be too much. I need to change the medicine doses. Follow for 1 week and get back to me, Swati. Just start the process. Whatever, it's okay if there was a break. Just follow everything for 1 week and get back to me. Divya, how many times in a day should I massage to increase the flow? I am giving massage 2 to 3 times and warm water compressions once in a day. Divya, I think you are in the under because this name is very much like I can recall this name, Divya. So Divya, I think you are under my treatment, I suppose. Are you the same one, Divyashri, or anybody else? If you are under the treatment, the how many times? So you are already given the protocol. Just check that protocol and let me know right now itself. Why are you asking this question how many times in a day? Because the protocol would be clearly mentioning how many times you need to do. Just check the protocol and let me know, Divya. Okay, so I don't see any new questions. Any new questions are there? Okay, वर्षा से जेरोलेक ब्रांड का फॉर्मूला मिल्क दे सकते हैं. फिर वही क्वेश्चन, मिल्क सप्लाई के लिए वर्क करिए. कोई भी जो फॉर्मूला दे रहे हो आप उसको दे सकते हो फिलहाल के लिए, लेकिन अपने मिल्क सप्लाई पे वर्क करिए और फॉर्मूला मिल्क को बंद करिए. ठीक है, अभी वो दे सकते हैं नहीं दे सकते हैं, अभी मिल्क सप्लाई अगर कम है तो देना ही पड़ रहा है अभी, लेकिन अपने मिल्क सप्लाई पे फटाफट काम करिए और ये फॉर्मूला मिल्क को हटाइए. ठीक है वर्षा, एनी अदर क्वेश्चंस? Divya, did you check the protocols? Let me know, Divya. Where are you? हाँ दिव्या. स्वाति, कफ और कोल्ड के लिए क्या करें? Divya, that is about the pumps. You were asking about the massage and the compress. Just check your protocols. Is it written how many times to do massage and how many times to do warm compress? Divya, check it and let me know. स्वाति, कफ और कोल्ड के लिए क्या करें मैम? तो कफ एंड कोल्ड के लिए आप लोग को एक बहुत अच्छा सोल्यूशन बताती हूँ कि कफ और कोल्ड के लिए ना पहली चीज तो आप लोग को एक ऑयल बनाना है. तो उसमें आप 200 ml करीब ये अगर आप नॉर्थ इंडियन हैं तो आप ये मस्टर्ड ऑयल यूज करिए. अगर आप साउथ इंडियन हैं तो आप ऑलिव ऑयल यूज करिए. एंड जस्ट पुट सम इंग्रेडिएंट्स. सो all of you who have want to ask about cough and cold, after this call just go to my YouTube channel. Just search cough and cold in babies. I have made a video on this oil recipe, and I have also made a full video on cough and cold for babies. It's an old video, but it is very effective. So after this session, go to the YouTube channel. My YouTube channel is in the name of Dr. Tanima Singhal, and just type cough and cold in babies and on the channel, and you will get the video. Just watch that. I have given a very good recipe of oil and methods of how to get rid of cough and cold. Then you will get the answers for all your questions related to cough and cold. ठीक है स्वाति? एसपी, मिल्क सप्लाई बंद होने की दवाई इफेक्ट कर रही है मैम. मिल्क फ्लो अच्छा नहीं आ रहा. फर्स्ट प्रोटोकॉल फॉलो कर रही हूँ. फिर से प्रोटोकॉल फॉलो कर रही हूँ. मिल्क सप्लाई की अगर बंद होने की दवा अगर आपको पहले कभी आपने ली है तो उसका इफेक्ट कितना 2 3 4 हफ्ते तक रहेगा, बस गया वो. अब अपने मिल्क सप्लाई पे काम करना शुरू करो. वो एक तरह से रिलैक्टेशन की तरह काम करेगा. आपको मिल्क सप्लाई के लिए जो जो चीजें बताई जा रही हैं उसको पहले फॉलो करिए. मुझे बताओ कि अभी आपने कितने दिन फॉलो किया एसपी? वर्षा, मेडिसिन कितने दिन लेनी पड़ेगी? अरे यार वर्षा, एक हफ्ता पहले फॉलो तो करो. अभी 3 दिन हुए फॉलो करते हुए, कितने दिन लेनी पड़ेगी? अरे पहले एक हफ्ता फॉलो करके डॉक्टर के पास वापस जाओ. वो पहले आपका रिजल्ट चेक करेगी कि क्या इंप्रूवमेंट हुआ. उसके हिसाब से आपको आगे के प्रोटोकॉल्स बताएंगे. अभी 3 दिन हुए, अभी कितने दिन फॉलो करना पड़ेगा? अभी फॉर्मूला के ऊपर बहुत कुछ होगा ना बच्चा, कि कितना फॉर्मूला बढ़ रहा है. अगर ऑब्वियसली फॉर्मूला अगर ज्यादा है तो मेडिसिन भी कुछ ज्यादा दिन चलेंगी. अगर फॉर्मूला जल्दी से कम होने लगेगा तो मेडिसिन भी कम चलेंगी. पहले एक हफ्ता फॉलो तो करो. Swati, I am having cough and cold, ma'am. Okay, so even for you, that will be very helpful, Swati. But otherwise, for cough and cold, just take a warm, this hot fermentation, and you can put this calvolol, this oil, what it is called as capsule in the water, and take the fermentation that helps to open up your nasal airway, and you can breastfeed the baby. Don't worry that if you have cough and cold, you will not be able to feed your baby. You will be definitely able to breastfeed your baby, Swati. Sumati, ma'am, I am on a protocol and pediatrician suggested Vivo Mom powder. Can I use during protocol? No, I would not recommend anything else other than the protocols. Just follow the protocols, just 1 to 7, 1 to 8, whatever pointers are being given to you, they are very effective. You just need to follow for 1 week and then get back to the team and follow the procedures further and get the milk supply out of it. Now, if you are asking about this, let me check the ingredients once. And if you're asking, just check the backside of it. How does it have preservatives or not? Because that is very important. If we need to, it is, just let me know in the chat box. Sorry, in the, I'm just checking it out. Just give me 1 minute. The brand which you have asked, whether it has got preservatives or not. Got preservatives added. I would not recommend it. I don't want any preservatives in your diet, so it doesn't need to go to your baby. And what you are asking is basically a protein powder. It is not a galactogog. So just follow the protocols as what it is given to you. Just follow them diligently to the point and follow it everything to get the best results out of it. Next question is from Srishti. I am North Indian, built my baby is allergic to mustard oil. Can I use olive oil in oil? Yes, you can use it. Swati, can I take any medication? Like which one do you want me to just ask me? Because you need to first see your physician, because if you have a lot of chest congestion, then they might be giving you antibiotics. If there is no chest congestion, then the antibiotics will not be required. If you tell your physician that you are a breastfeeding mother, they will give you medications as per the breastfeeding mother. So yes, you can take the medication, but they should be breastfeeding safe. So don't take it by yourself. Just talk to your physician and then ask for medication for cough and cold, Swati. SP 1 month, मैम. क्या है ये? मतलब बीच में ना छोटे छोटे आंसर्स लिखते हो. मुझे पहले वाले क्वेश्चन के साथ बताओ ना क्या हुआ है. आप शायद लिखे थे मिल्क सप्लाई बंद होने की दवाई इफेक्ट करी है, अभी फिर से प्रोटोकॉल फॉलो कर रहे हो. ठीक है, तो पहले 1 हफ्ता अच्छे से फॉलो करो एसपी, और फिर जिसको भी आप दिखा रहे हो, आप मेरे को दिखा रहे हो या मेरे और किसी डॉक्टर को दिखा रहे हो, उनके पास वापस हेल्पलाइन को बताओ और 1 हफ्ते बाद अपना ट्रीटमेंट आगे बढ़ाओ. वर्षा, नहीं मैम, मैंने 12 दिन से ले रही हूँ मेडिसिन. भाई अगर आपने अभी तो आपने बोला ना मैंने 3 ही दिन से प्रॉपरली फॉलो किए हैं, प्रॉपर प्रोटोकॉल्स फॉलो नहीं किए थे. वही तो बोल रही हूँ कि 3 दिन अभी फॉलो किए थे, तो अभी पूरे 7 दिन पूरे कंप्लीट करो, उसके बाद टीम को बताओ. एसपी मिल्क फ्लो अभी इतना नहीं आ रहा है, 30-40 इतना ही आ रहा है, बढ़ नहीं रहा है. तो पहले 1 हफ्ता एसपी प्रोटोकॉल्स को प्रॉपरली फॉलो करो और वापस आओ. क्योंकि अगर 30-40 ml आ रहा है तो इसका मतलब ये नहीं है कि मिल्क सप्लाई बंद हो गई है. 30-40 ml से बढ़ाना बहुत आसान है, लेकिन 1 हफ्ता पहले प्रोटोकॉल्स फॉलो करिए और फिर वापस आइए. Swati, thank you, ma'am. You're most welcome. Diksha, I wanted to quickly ask, my baby is 3 months old and I am on breastfeeding, but her weight is 4.8 kg. As per doctor, it's quite low. Is it low? What was the birth weight, Diksha? So write this question again in the chat box so that I am know, and put the birth weight and then put the present weight. So the galactolactation granule is it good, ma'am? Galact has also got preservatives like methyl parabens, and it has got this soda propyl parabens. Parabens, they should not be given to like they we don't use in this our, you mean shampoos and creams also. We use this paraben free shampoos, paraben free creams, and the Galact which you're asking, that has got parabens in it, not advisable. Divyashri, advised to massage for 4 times. See, it is written in your protocol, and then still you're asking. Follow it properly, Divya. Yukti. Hi, ma'am. My baby are not latching my breast because my nipples are not normal. क्योंकि मेरे निपल भर नहीं है, बाहर नहीं है, इसलिए मैं काउ मिल्क देती हूँ. काउ मिल्क? बच्चे कितने बड़े हैं युक्ति आपके? 1 ईयर से कम है तो नो काउ मिल्क. काउ मिल्क में केसिन प्रोटीन होता है जो आपके बच्चा डाइजेस्ट नहीं कर सकता 1 साल के कम का. सो नो काउ मिल्क युक्ति. और अगर आपका बच्चा 1 साल के ऊपर है तो आप दे सकते हो. लेकिन जो आपने बोला कि मिल्क निपल बाहर नहीं है, ऐसा कुछ नहीं होता. बेसिकली आपको एरियोला यानी कि जो निपल के चारों तरफ काला भाग है उससे फीडिंग करानी होती है. आपका मिल्क सप्लाई अगर अच्छा है तो आपको प्रॉपर लैचिंग टेक्निक्स के साथ बच्चे को लैच कराना है। निपल नहीं भी है, निपल फ्लैट है, इन्वर्टेड है, उससे कोई फर्क नहीं पड़ता। एसपी गैलेट कैरियोस यूज कर सकते हैं क्या? बताया तो अभी, गैलेट में ये मिथाइल पैराबेन्स पड़े हुए हैं, अभी खुद ही चेक कर लो आपके पास अगर है ना। अगर चलो मैं दिखाती हूँ आपको, लेट मी शो यू, मैं शेयर करती हूँ आपको। जो को पूछना है कि कौन कौन सा यूज कर सकते हैं कि नहीं, चलो मैं सबको आज दिखाते हैं, क्योंकि आप लोग को डाउट होता है कि ये यूज कर सकते हैं वो यूज कर सकते हैं। तो हम सबसे पहले गैलेट की बात करते हैं। तो इसमें देखोगे अगर आप, ये देखो, ये बैक साइड इसका देखेंगे अगर, देखो, प्रिजर्वेटिव्स, सोडियम मेथाइल पैराबेन, सोडियम प्रोपाइल पैराबेन्स। पैराबेन्स हम लोग क्रीम्स और शैम्पू में भी यूज नहीं करते हैं, और तुम लोग बोल रहे हो कि खाने में यूज कर सकते हैं क्या? ठीक है, तो हम ऐसी चीजें यही यूज करेंगे जिसमें प्रिजर्वेटिव पड़े हों। नेक्स्ट, स्वाति, क्या फॉर्मूला में प्रिजर्वेटिव होते हैं? अरे, तो कैसे वो प्रिजर्व होता है? डब्बों में कितने कितने महीनों तक वो, पहले तो फैक्ट्री में बनता है, फिर वो मेडिकल स्टोर में रखा रहता है, फिर आपके घर में आता है। तो आपको क्या लगता है बिना प्रिजर्वेटिव के फॉर्मूला मिल्क बन जाता है? और दूसरी चीज, आपको क्या लगता है वो किस चीज से मिलके बना है? क्या लगता है आपको किस चीज का बना है? वो सब सिंथेटिक दूध है, सब लैब में बना, उसका नाम है फॉर्मूला, सब लैब मेड है वो। Mrinmay, ma'am, doctor from hospital suggested me the protein. Shall I continue or stop? Which one? Just let me know in the chat box. युक्ति, मेरा मिल्क भी बहुत कम आता है, 1 महीने की मेरी बेटी है। मिल्क सप्लाई पे वर्क करिए, मैंने अभी बताए हैं कुछ मेथड्स मिल्क सप्लाई को इम्प्रूव करने के लिए, उसको फॉलो करिए। अगर 1 महीने की आपकी बेटी है तो मिल्क सप्लाई जल्दी इम्प्रूव हो सकता है। आप फॉलो करिए, 1 हफ्ता फॉलो करके देखो, अगर रिजल्ट्स नहीं आ रहे हैं तो फौरन ट्रीटमेंट लेना स्टार्ट करो। आप हमारी टीम के डॉक्टर्स के साथ ट्रीटमेंट अच्छे से ले सकते हो। ऑनलाइन भी बहुत आराम से वर्क करता है, दैट विल हेल्प। बट अगर आपको लगता है मैं खुद एक बार ट्राई करना चाहती हूँ, तो मैंने मेथड्स बताए हैं, उसको आप फॉलो करिए। Diksha, my baby is 3 months old and I am on breastfeeding and her birth weight was 2.75 and now it is 4.8. So 3 months. So we need 2.4 add to 2.75. So it should be 5, 7, 8, 9, 10, 11, 1, 2, 3, 4, 5. It should be 5.15. It is 4.8. Yes, it is less. So we needed 5.15 and it is 4.8. Yeah, so we need to work on the weight also, Diksha. Sri Vidya, what are the protocols? So Sri Vidya, the protocols are given as per, if you are taking the treatment from us, then we give the protocols. Right now, the general protocols like how to increase the milk supply that I have already given. But if you want the customized protocols for yourself as per your routine, you need to consult our doctors or either me. युक्ति, मेरी बेटी बार बार फ्रेश हो रही है, मैं क्या करूं? अगर आप बार बार उसको मोशंस आ रहे हैं तो आप एक बार अपने पीडियाट्रिशियन को दिखाइए, छोटा बच्चा है, डिहाइड्रेशन हो जाएगा तो मुश्किल होगा। अगर उसको बार बार मोशंस आ रहे हैं तो एक बार अपने पीडियाट्रिशियन को दिखाइए। श्री विद्या, इज इट अवेलेबल इन चैट? नो, यू नीड टू हैव आइदर अ वॉइस कॉल और अ वीडियो कॉल। Mrinmay, the protein, ma'am. So, like Mrinmay, is it only the protein you are following, or are you following some galactogogues also? Because protein is fine, you can take, but I would prefer to have the proteins which are like from the homemade food by eggs or by diet. And for galactogogues, you can take some supplements. Only this the protein. Okay, are you giving formula milk also, Mrinmay? Yes, then we need galactogogues also, na Mrinmay? Are you under treatment of any of our doctors? Yes. Then follow the process. If you have not purchased the protein, then you can, no need of like purchasing it now. Just follow the protocols which are given from our doctors. Okay. युक्ति, so bring my where were you? युक्ति, मैम आपकी टीम से कैसे बात हो सकती है ब्रेस्ट मिल्क के बारे में? आपके लिए मैं एक नंबर बता रही हूँ, आप इसको कल कांटेक्ट कर लीजिए इस नंबर पे। तो उससे आपको कंसल्टेशन के डिटेल्स मिल जाएंगे। अगर आप लोग इंटरेस्टेड हो कंसल्टेशन, मुझे लगा था सब यूजुअली टीम के अंदर से ही आते हो आप लोग, मोस्टली वही होगी जो लोग ऑलरेडी ट्रीटमेंट ले रहे हो, बट अगर कुछ लोग आप लोग ऐसे भी हैं जिनको अभी जिन्होंने ट्रीटमेंट नहीं लिया है, तो मैं नंबर डाल रही हूँ 9369037490। ये इंक्वायरी टीम का नंबर है। सुबह 10 से लेकर के शाम 5 साढ़े 5 तक आप कभी भी कॉल कर लो, टीम वहां पे रहती है। संडे नहीं रहती है, मंडे से सैटरडे के बीच में आप कॉल कर सकते हो। अरे मिनट में कुछ रह गया। टीम वो मैंने मैसेज में उसमें चैट बॉक्स पे डाल दिया है नंबर। नेक्स्ट है वर्षा मैम, मेरा बेबी का बर्थ वेट 2.9 था, अब 3 मंथ 23 डेज का है, वेट 6.3, तो मैम उसका वेट लॉस तो नहीं है? 2.9 है बर्थ वेट, और बताया कितना? 3 मंथs 23 डेज, सो लगभग 12 वीक्स तक हमको 2.4 चाहिए था, 3 मंथ्स और 3 वीक्स और, सो 150 153 4.5 450, तो 400 ले लेते हैं। 9 10 11 12 13 14 15 16 17 7 2 3 4 5 5.7। अरे वर्षा, तुम्हारा तो बेबी का वेट बहुत अच्छा है। देखो हमको बर्थ वेट के हिसाब से हमको 3 मंथ्स पे 2.4 kg प्लस चाहिए था, तो 2.9 में 2.4 ऐड करो, फिर 23 डेज यानी लगभग 3 वीक्स, तो 150 ग्राम्स के हिसाब से हमको 450 ग्राम्स और चाहिए वहां पे, तो 400 मैंने ऐड किया, तो टोटल मिला के 5.7 होना चाहिए। और आपके बेबी का वेट तो 6.3 है। अगर आप फॉर्मूला दे रहे हो तो आप ज्यादा दे रहे हो वर्षा। फटाफट 7 डेज कंप्लीट करो, टीम को पहुंचो, और ये आपका वेट गेन बच्चे का ज्यादा हो रहा है, आपका फॉर्मूला बेबी का कम करना होगा इसमें। Sumati, ma'am, for breast massaging, can we use any other oil? You can use it, but the oil which I suggest is Dr. Mix massage oil. That is a Ayurvedic recipe. It helps to boost the milk supply local, like the cells, which helps to improve the milk supply locally, and it helps to improve the blood circulation. So that helps to improve the overall milk supply. Okay, so that's all for today. I don't see any new questions. If you have any questions, you can put in the chat box. And my baby is trying to push motion all the time and starts crying super gassy all the time, though I'm burping. So, just a minute. My baby is trying to push motion all the time. Super gassy. So for gas issues, what you can do, you can take some hing or asafoetida, what we call in English, and just take a little oil, water, and then warm this solution and make a paste and apply around the navel of the baby, and take a warm, take a cloth and warm it on a press or on this roti tawa, and just check it should not be too hot, and then do some warm compress for the baby's tummy, and then just like cycle the baby's legs, and that will help to release the gas. Just do that. Amrit Pal says, yes ma'am, I am doing it. She passes motion with difficulty. Okay, just try to feed the baby more. The more breast milk she will get, the baby will start like this will help to relieve the gases and all that. So those who are asking oil massage, I am putting it in the chat box. Dr. Mix massage oil. The name is there in the chat box of the oil. Sri Vidya, my baby's birth weight is 3.02, now 4.07 at 3 months, 26 days. So this is nearly 4 months. So we need 2.4 and then 600, 3 kgs we need. So 6.02. Hey, the weight is very less. The baby has gained only 1 kg still 4 months. Sri Vidya, the weight is very less. Why is it? The baby's birth weight was 3.02 and now it is 4.07. The baby has gained only 1 kg in 3 months, 26 days. This is not good.
Yeah, ma'am. It was actually. Uh, is my voice audible?
Yeah, it is there.
Yeah. Actually, since November 10th, I went for checkup. It was something like 4.6. Then I switched completely to breast milk from November 11th to till now. Then I checked.
No, then don't do this way. You should
Okay.
never stop anything like that. So you
Okay.
need to, like, what happens, see how I work in this. suppose I need to reduce the formula. So I don't stop it like that. I give the mother the techniques of improving the breast milk, and I keep the track of the baby's weight. So suppose I need the baby's weight at 3 months around 150 grams per week. I ask the mother to
Okay.
check the weight on day 1 and day 7. If the weight is
Okay.
more than 150 grams, then I start
Okay.
reducing 10 ml of formula from every feed. So
Okay.
suppose if I reduce 10 ml from every feed, it becomes 80 ml in per day. Now I check the weight after 1 week again. So if the weight is
Okay.
already increasing, then only I start reducing the formula. If you suddenly stop the formula, the baby will lose weight. This is not good.
Okay. Yeah, yeah. Right now,
Okay?
from today again, I started using formula milk to baby. And
It's
today I
okay.
saw your webinar in the chat box and I joined. I'm thinking of
Good.
consulting you regarding this because he need to gain weight.
Yes.
Yeah, yeah.
Yeah. So you would have, if you joined the webinar today, have you joined the program, this 1 month program?
No, I didn't join it, but I need to
Then how are
join.
you going to plan? How are you going to plan to work with me?
Yeah, that the number you have given, right? I will be consulting the team through this number
Okay.
and I will be
Okay.
trying to join.
Yeah.
I'll try
So
to
do
join.
that.
Yeah.
It's
Yeah, yeah.
it's very important right now because the weight gain is very less. It is just 1 kg in 4 months,
Yeah,
which
yeah,
is not good.
exactly. Yeah. Yeah, yeah.
Okay. Hmm.
Yeah.
Okay.
Thank you.
Okay, so Mrinmay says, thank you. You're most welcome. Sumati, ma'am, my baby's birth weight is 2.9 and now 1 month. Hey, everybody, all of you are asking me the weight gains. So just check by yourself. I'm telling you. For first 3 months, add 200 grams per week to the birth weight. So at 3 months, if your baby is exact 3 months, add 2.4 in the baby's birth weight. Okay. So, right, as you said that 1 month, 20 days, it is 4, 5, 6, 7, 7 weeks, 7 to the 14, 1.4. So 1.4 and 2.9, 9, 10, 11, 12, 13, 2, 3, 4, 4.3. It is only 4 kgs. Hey, all of you, your baby's weights are not increasing. I don't know how you people are working, Sumati. It is less. Maybe there was a lag. Now start working. It should increase at 150 to 200 grams per week. युक्ति मैम मिल्क को बढ़ाने के लिए कोई डाइट चार्ट है क्या जिससे मैं खुद ही ट्राई कर सकूं? डॉक्टर मिक्स मसाज ऑयल कहाँ मिलेगा? गूगल पे डालो, अमेजोन पे डालो, फ्लिपकार्ट पे डालो, कहीं भी डालो, मिल जाएगा। और बाकी युक्ति डाइट चार्ट के लिए आपको प्रोटीन अपने डाइट में इंक्लूड करना है, अदरवाइज लैक्टोमैजिक पाउडर और मोरिको टैबलेट लेना स्टार्ट करो। पानी अच्छे से पूरा पियो, मसाज और सिकाई करो, बच्चे का वेट गेन चेक करो, ये सारी चीजें करो युक्ति। Okay, that's all for today. Any new questions? I don't see any new questions. So it was good to talk to you all. If we have, I hope the session was helpful for you all. So Vaisha ma'am, मैं गुजरात बनसकंठा से हूँ। हमारे यहाँ है मेरी जैसी न्यू मॉम है जो लो सप्लाई से परेशान है और बेबी को फॉर्मूला या काउ मिल्क दे रही है। अगर मैम मेरा मिल्क सप्लाई अच्छे से हो गया तो मैं कॉन्टैक्ट में जो भी न्यू मॉम है उसको ज्वाइन करूंगी। मैं आपसे टीम से ज्वाइनिंग किए तो मुझे पॉजिटिव फीलिंग आ रही है कि मेरा मिल्क सप्लाई इंक्रीज होगा। वेरी गुड वर्षा, बिल्कुल होगा। अच्छे से करोगी तो बिल्कुल होगा, करने से होगा, सबसे इंपॉर्टेंट। जैसे बोलते हैं ना योगा से होगा, वैसे ही यहाँ पर भी है। अच्छे से करोगे सारा चीजें प्रॉपरली तो बिल्कुल होगा वर्षा। वेरी गुड। सुमति, बर्थ वेट कैलकुलेशन मेथड विल मैसेज योर मैम। अरे यार तुम लोग मेहनत वाले काम करवाते हो, मैं बता तो रही हूँ ना, लिख लो बाबा। 150 to 200 grams per week till 3 months. 3 to 4.5 months, it should be 100 to 150 grams per week. From 4.5 months to 6 months, it should be 100 grams per week. That's all. ठीक है? Okay, so that's all for today, girls. Take care. Bye bye. See you all next Friday. बर्थ वेट गेन हिंदी में भी समझाओ मैम। ओके। 3 महीने तक 150 से 200 ग्राम हर हफ्ते चाहिए। 3 महीने से 4.5 महीने तक 100 से 150 ग्राम हर हफ्ते चाहिए। 4.5 से 6 महीने तक 100 ग्राम पर हफ्ते चाहिए। ठीक है वैष्णव? ओके, बाय एवरीवन।